So please welcome President Clinton and Joe Kiani.
Good afternoon, gentlemen. As a person in long-term recovery myself and as the leader at a federal agency who is dedicated to leading public health responses for the addiction crisis, it's an honor to join you both on this stage this afternoon. Let's start with you, President Clinton. In this meeting today, there's a diverse group, a very diverse group of people who are all involved in responding to the overdose crisis in one way or another. We got hospital administrators here, we have physicians, we have faith leaders, we have elected officials, community advocates, and recovery experts. As president, you were masterful at bringing together diverse groups and perspectives together to achieve a common goal. And you continue to do this as a private citizen for all these years. Thank you for that. This crisis requires that same kind of commitment. So what can we do to improve the multi-pronged approach and coordinate our efforts?
Well, first of all, I think my answer to any question like that is always start by picking the low-hanging fruit. That is, there are people working on this issue in every community in America. And most of them have a very strong idea about what they need and what they don't have. And I believe that we should first fill in the blanks. Then I think we should ask ourselves, since more than 100,000 people are dying every year of overdoses, how can we save the most lives? Then it's a whole different step to say, how do you rescue people or get them in recovery and everything? And I got interested in this first because I grew up in an alcoholic home, second because I had a brother who was a cocaine addict, and third because I had 4 friends whose children died because they didn't know that they couldn't mix any amount of alcohol with opioids. And there's still, to this day, after all these years, there's still people who go out and drink and then pop some sort of pill to get a buzz. Now, this is over and above this horrible toll of fentanyl. So I just figured that we ought to try to fill in the blanks. So what I've tried to do is to build a faith network and support those that already existed across all cultures and religions in America to get people to do what it takes to stay alive. And then I've worked with Pfizer and any number of other groups, and we tried to put Narcan and other life-saving mechanisms in the hands of people. And then I've tried to support Joe and Masimo and what they've done in finding other technological bridges to survival. But anyway, I think you start with the low-hanging fruit and serve as many people as you can, then you figure out how to fill in the blanks. I don't think it's complicated. I think there are, and I can't think of an issue right now in America that has more sort of non-political approach. This is, fentanyl has a remarkable bipartisan homicide record, if you think about it. And so that's what I think, and I do what I can.
It certainly doesn't discriminate, does it? Fentanyl, or any drugs for that matter. It's attacking everyone in the same exact way. So I agree that it's been amazing to see the bipartisan support that we have had for this on both sides of the aisle, or we can even say nonpartisan. This is a nonpartisan issue. Joe, when we talk about getting help for a problem with opioids, people often think about things like medications for opioid use disorder, or MAT, harm reduction approaches, and even abstinence-based recovery. But we often overlook the role that technology can have in solving some of these issues. In this digital age, how do you see technology helping to keep people in recovery and prevent overdose?
Well, thank you for that question. First, I just want to tell you that we do have technology that for 80% of the people with nerve stimulation behind the ear, it can kick their withdrawal symptoms. I've heard people that have opioid addiction, they say they first take opioids because of the euphoric feeling, the great feeling they get. And then when they try to get off of it, it is so painful, they think they're gonna die. So they never try again. And that's one reason they just keep going back to it. They're not going back to it because they want to, they just can't stand the feeling when they try to get off of it. So this product we have, Bridge, that stimulates the vagus nerve and the ocular nerve and the cranial, it helps in 20 minutes for 80% of the people. But I want to circle back to what President Clinton said. When I started Masimo in my garage in 1989, I thought if we could make pulse oximeters work accurately during people moving and low perfusion, we could save the lives of people in hospitals with opioids, because they were dying in hospitals from opioid induced respiratory depression. I was at lunch with President Clinton, and by the way, that technology did work. We invented the modern pulse oximetry. Dartmouth Hitchcock did a 10-year study that showed with our technology, the group that had it, no one had died or brain damaged from it. Yet the group that didn't had several deaths and they had brain damage, and it saved them $7 million a year. I was telling the story to President Clinton, actually at lunch. I don't know if Nima's here at his house, and he started telling me about these stories of his friends' kids who died from opioid at home. And President Clinton said to me that, do you know 50,000 people, this is a little back ago, now it's 100,000 people, 50,000 people died of opioid overdose at home? Joe, you gotta go do something about that. And I went home that night, literally I couldn't sleep. I sketched out how we could do it. And then the next morning I went to my team and I showed them what I was thinking and why I was thinking that. They got excited and we began developing it. That became Opioid Halo, which by the way, during COVID was used for COVID patients. And Opioid Halo, not only FDA gave it breakthrough status, chose it as one of 8 products that could help defeat the opioid epidemic, but it's the only product that's ever been cleared, OTC or RX, so that if someone's taking opioids and they're about to die of opioid overdose, it tries to wake them. If they don't wake up, it'll send an alarm to someone they've pre-designated. And if they don't respond, it'll send an alarm to the nearest ambulance with their location on it. So these are the technologies, Opioid Halo, and once we got into that, we ran across Bridge, and Bridge that can add to naloxone, which is the only other technology I know that's available to help people. And we can defeat this epidemic, not make it look like it's a disease of bad people, but like any other disease, and help people survive it until they kick it.
Amazing, amazing.
I want to emphasize how important this technology is and why we need to get it everywhere. The problem that I could never figure out how to deal with was I could negotiate, based on my work with AIDS drugs and other things, we could negotiate better prices for Narcan or even big blocks of gifts, and we helped Pfizer distribute 1 million doses of Narcan, and we did a lot of other things with a now defunct but are submerged, a little Irish company called Adept, which gave us the first steep discounts. I knew how to do that. But the problem is that he addressed was you can bring back almost anybody with Narcan, but you have to be there with them, and you have to know it. All these young people that I knew who were the children of friends I cared a lot about, they'd be alive today if they passed out at an outdoor cafe. But if they just went to bed and never woke up, they were alone. That's what, so he actually created this
Thanks to you.
technology.
Inspiring it.
Well, that's because I didn't have no sense to do it. I had no idea how to do it. But we all need a friend like this. You call them on the phone, hey, Joe, I just thought of this little problem. You solve it. Then I announce it and say, gosh, that's great. Anyway,
You're so humble.
but think of this. It's really, no one has to be alone with this technology. That's the way you should think about it. Yeah. It's like we've had the drugs for years. We could save people and then get them to get some proper treatment and all that. But not if something happens to them. I was just looking at this picture Hillary sent me over my phone of a brilliant woman and her daughter and her husband. And we went to school with the husband while she was getting a PhD in biochemistry at Yale. And they were both, the husband and the wife, the children of black preachers in Beaumont, Texas. And he was an all-Southwest Conference lineman and looked like he could play college football till he was almost 70 years old. I kept telling him I had to keep living so I could finally wait for him to look as old as I was. But anyway, they had a daughter who was fluent in French, Spanish, and Chinese, and who was both a lawyer, and she translated French novels into Spanish just for a habit. And she had some misfortune in her life. I don't want to go into it, but she had moved from California to Denver. Their parents were from Texas. So her dad couldn't find her after a day. They talked every day. And he asked the police to go check on her, and they found her sitting up watching television, rigid, stone dead. If there had been, this woman did not want to die. If this technology had been in every room and suite in the apartment she was staying in, the apartment complex or the hotels of the community, if it becomes a normal part of life, a lot of people are going to live. So,
Yeah. So low-hanging fruit, that's a really good piece of advice, but what we've seen in this crisis is that we've picked a lot of that low-hanging fruit. And, the overdose crisis is so overwhelming, and what we've been doing, looking at the numbers of people who have died, it just isn't enough. It just isn't enough. And you've talked about how we should not get discouraged about the complexity of the problems before us. After all, you're the man from hope, right? You are the man from hope. And can you expand on that piece of advice for this group as we try to tackle this issue together?
you just have to keep going. Joe Biden woke up this morning saying, well, that wasn't my best night. Right? And then he thought, But I know this, country's in better shape than it was by light years when I took over. I know, look, I know we dramatically increased vaccinations for COVID. And in the places that fought vaccinations, the hospitalization rates and the death rates were markedly higher. I know we've created more jobs in less time than at any time in the history of the country. I know that the real problem with immigration is not that people are anti-immigration, they're worried about the chaos, and what happens is we had a system built for X number of people, approximately 400,000 a year, that's been asked to digest up to 2 million a year. Lyndon Johnson, not any of these politicians around today, signed a bill in the early 60s saying that if someone comes to our borders and they have a legitimate fear of danger to themselves or their children, they can become immigrants. They can't jump the line on becoming citizens. In spite of what you may have heard last night, nobody's trying to vote. None of that stuff was, but the problem is you can't jam 2 million people a year through a system that was built for 400,000. So if you want to fix the problem, instead of use the problem to divide everybody, you got to figure out a way to properly vet everybody and let them live decently while they are, and don't divide them from their kids. And if you do that, most of this problem will go away. Meanwhile, for every 6 immigrants, 5 new jobs, or every 5 immigrants, 6 new jobs are created for native-born Americans. When people get through who shouldn't, they commit crimes sometimes. But the crime rate of the native-born is far higher than the crime rate of immigrants. And so we go around dealing in a fog. That's the way this opioid thing strikes me sometimes. We've got so much low-hanging fruit here. All the things we know, we go around in a fog of grief for those we lost and saying how terrible it is and why don't we do something. And you got to just keep going. And, you know, since I'm a Democrat, that's what I want my president to do. But what, no. The point I'm making is this has nothing to do with partisan politics. Every day we all get up and our spirits are in their early morning stretching exercise inside our heart. And it's almost like there are these great scales, you know? Like this morning when I woke up, my scales were in a pretty good place. And I thought I was going to be upset when I went to bed that night. But we're all like that. There's more hope and there's more despair. More optimism, more pessimism. And the older I get, the more I realize is that, you know, about all you can really do in life is put your hands on the right side of the scale and get the show on the road. That's about all you can do. With all your knowledge and experience, you got to keep going. And so that's what I would say. Our opioid response network and all the faith leaders is one of the most moving things I've ever done, because I've seen these people who thought they had nothing in common realize that if they believed in a higher power, surely one thing that the higher power wants, however you define it, is to save as many of us for as long as can be saved, to live as long and well as you can. And so I hate to imbue religious significance, which would make him uncomfortable, but the fact is that Joe Kiani has spent a lifetime trying to figure out how to help people live as long and as well as they can, and how to build a profitable business doing it that is not price gouging, but frontier breaking, because if you do that, you get more and more users, and high volume with lower margins is far better than low volume with very high margins. And so just don't quit, just keep going.
And I added a couple of thousand jobs, this immigrant.
What?
And I said this immigrant added a couple of thousand jobs in the U.S.
Yeah, there was one or two.
Yeah.
Thank you for that spiritual food for our soul. I think we all needed that. Let's give the president a round of applause. I was chatting a little bit, before your introductions about the dynamic nature of this crisis. It's not a static crisis; it keeps changing, and I think that's one of the things that's taking us in different courses, right, in different directions. We're also seeing a real shift in who's dying of overdoses. More older people, mostly men, an increasing number of people of color. Do you guys have some thoughts about this? What's going on? Why the shift? And how much of it is connected, with, you mentioned fentanyl earlier, so we have this changing drug supply, synthetics. We also have, isolation that COVID forced upon us, which we know there's going to be a very long tail from. In addition, there's these longstanding inequities. People don't have the same kinds of access to social determinants of health, home, purpose, community that we define at SAMHSA as being critical for somebody's recovery. Do you guys have thoughts about that?
Well, the one thing I want to say, I don't think the low-hanging fruits have been picked yet. Up until a couple of years ago, we didn't have Bridge, we didn't have Opioid Halo. All we had was Narcan. Now we can help people kick their addiction. We have some people here that I can, maybe Bailey, I don't know, you're here. Is Bailey out here? Bailey, Chesterfield, jail. Would you mind this? Could someone get her a mic? I want you to talk about your experience with Bridge.
Thank you. Hi, everybody. My name is Bailey Hilliard. Thank you so much for having me here today. And I run drug treatment programming inside a jail in Chesterfield County, Virginia. And our program, it quite literally started 10 years ago almost, where our sheriff went through our intake unit after the 10th overdose death in our county happened, and he looked at people withdrawing, and he picked them up off the floor. You see people withdrawing and in jail, they are curled up on the ground, and they are on the cement floor, and there's no help for them, really. You just have to go cold turkey. And it is one of the most painful, inhumane things to watch. And over, almost the decade now, we've gotten to do a lot of incredible things for treatment. We have, just so many incredible humans in recovery and all the good data to support that. But last summer, we actually got to meet with President Clinton and Masimo in New York City, where we learned about the Bridge device. And I can tell you guys that bringing the Bridge into jail has been incredible. We have seen people who are, again, quite literally in medical crisis, curled up on the floor, looking like they're about to die, that have to then go to the hospital and take our deputy staff with them, which is a burden on the law enforcement system. We already don't have enough staff. And within a matter of 10 to 20 minutes, they're up and they're talking to us. They are up and they're moving. And really just the ability to restore dignity and worth and value to a population that society has cast aside. And you guys talk about low-hanging fruit. I would say that our jails are incredibly low-hanging fruit. They're a place where people go and they have to withdraw. They have to make a choice if they're going to continue in recovery and continue in sobriety, or if they're going to go back out and use. And having access to good treatment, good care, good reentry in jail, it's a huge piece of it. And thank you so much for introducing us to the Bridge, just so that we can actually give people some dignity and worth. And it's been incredible.
Thank you. Thank you so much, Bailey, for what you and your colleagues are doing. And I do feel like there is hope now. There's new things we can do. The Bridge is a great example, but Think about it. We don't give someone insulin without blood glucose meters or CGM. Opioid, which is a much more deadly drug, is prescribed without a way to monitor if they're overdosing. I know of a sister and brother who went for a tonsillectomy in Utah. The brother was twice the size of the sister. The same doctor gave them both the same dose. The brother that was twice as big took half the dose and never woke up. So people react differently. Of the 100,000 people that died of opioid overdose, 20,000 is from prescription opioids. There should be a day that no one is given opioids without a monitor. So we do have brand new things that I think can give us hope. But to answer your question, I'm sorry it took me a while to get back to it. Why is it afflicting more men now, more people of color? I think, unfortunately, the social determinants play a big role. You know, only 10% of people get help. 90% of the people don't get help. And if you're someone with poor background, you're less likely, unless you go to the jail, and that's why I want you to talk about that, to get that help. I know one person that watched the news that turned herself in to get bridge. She turned herself into jail to get bridge. So I think we need to find a way to get these things in the hands of people, and we can hopefully go from 100,000 deaths to maybe 20,000, hopefully zero.
What are the barriers, Joe? What are the barriers in getting more innovations into the hands of people who need them?
President Clinton talks about it's good to have a friend like Joe. Well, it's great to have a friend like President Clinton. They put Narcan on people's radars years ago. I mean, right now we went and took a picture next to a box that every college has now. They put Narcan out there. So the fact is willing to come out, whether it was a meeting in New York and now here, to talk about opioid halo, talk about bridge. The awareness is critical. And we're working to make it as affordable as we can. We're trying to go from a finger sensor with opioid halo to the wearables so people with illicit use can feel comfortable. Because the problem is what President Clinton says. If they take opioids and don't go to sleep, they won't die. But if they go to sleep, the same pain relief that opioid gives you, it also unfortunately stops you from worrying about your pain of not breathing. The CO2 buildup that makes us all want to breathe, you don't feel that pain and you die in your sleep. So if you're taking opioids and you're sleeping, you should have something that alarms if you're about to die from it. So I don't know, President Clinton, thanks for allowing me to answer this question first, but what do you think is, how do we get this stuff out there in a bigger way?
Well, there are several things. First of all, thank you for what you said and what you've done, but I've studied this up close and personal, you know, because my brother, as I said, was once completely controlled by cocaine. And he's about to come up on his 7th anniversary of sobriety. And so I watch this stuff. You have to want to live. Otherwise, you can arrange to die. And one of the reasons that we do so much, and I want to give credit to Chris Thrasher, who's over here, who runs he runs our faith groups. We can never forget that A, this is a disease that has to be treated, and B, none of us are rational about our faults, whatever they are. Not you, not me, not anybody. None of us are really rational. First, we want to pretend like we don't have them. Then we want to pretend like we can handle it. Then we want to pretend like no matter what happens, things will work out all right. And pretty soon we stop not caring whether they work out or not and not being aware of it. I mean, you have to set up a system that is premised on the idea that people will want to live as long and as well as they can. That requires a certain amount of mental health. You all agree with that? So, I mean, otherwise you doesn't work. So put yourself in Joe's position. This is what he lives with every day. So I developed this bridge. It will ease the withdrawal from opioids by 80+% for 80+% of the people. And has all kinds of other helping qualities. So what's he supposed to do when people aren't knocking down his door for the device? What's he supposed to do when he finds out where the people are who would knock down his door but don't have the money to buy it? Can he go to the government and get a public reimbursement? Can whatever? You know, and I spent a lifetime trying to figure out how to do stuff. People ask me all the time, you know, what was your secret? Or why has the Clinton Foundation done so well with AIDS or with the Clinton Global Initiative? And I said, I try to get everybody to agree on what, and then spend all our time arguing about how. Because if that's really what your focus is in, 70, 80% of the time we could reach agreement across party lines, across geographic lines, across psychological lines, if we agree on the how. I mean, if we agree on the what, then all of our diversity becomes an advantage. Then all the stuff you see where we want only to be around other people just like us, and we don't want to be around people that are different from us, and we don't really trust people that are different from us in this terribly political sort of age. But if you all agree on what you want, then instantaneously your differences become incredible advantages. George Bush and I do a presidential leadership program every year. And we bring 60 people between more or less the mid-career professionals, between 29 and 40. They come to his library and mine and his dad's library and the Lyndon Johnson library, and they study aspects of decision-making, and then they come back and break up into groups. And they're very diverse. I mean, it's in every way you can imagine. And the only thing they have to do is, before they start, agree on what it is they would like to see better. What problem do they want to solve? What opportunity they want to seize? And we've been doing it now for almost a decade, and about 80% of the time they reach complete agreement, and they're all shocked. And then we do a little, because of the way we talk about each other in the political arena. So then we do a little graduation every year, and we alternate between the Bush Library and mine in Arkansas. And when we do that, and we always do that together, the Democrats go up to him, and the Republicans come up to me and thank us, because they didn't know, since they follow the news, that there was anybody like us on the other side of the Great Divide. I mean, it's crazy. And so my favorite was about 4 years ago, we had these two huge guys who were Afghan and war vets. One of them in Iraq. One of them was fought in Iraq and Afghanistan, and both had lost legs below the knee to roadside bombs. One of them even still had the shrapnel in his face that hadn't been removed yet surgically. And so they came up to me and they thanked me. They said, you know, there's a woman in our group What they wanted to do was to help veterans integrate back into society and begin their lives again and get over all their scars. He said, there's a woman in our group who's got all the skills we need. She is perfect for us. She's just everything. She knows things we didn't know. And she was about 5'10" or 11 and was very big and tough looking. And she ran the gay rights movement in Arkansas. And they said, you know, before we came here, we didn't know there was anybody like her. We didn't know who to call to find out how to run a veterans relief organization. And all of a sudden, here we are. And we think she's wonderful, and we are so grateful. Now, that could happen 1,000,000 times a day. And that would help to empower things like all of your work. Then I think it's worth remembering that if you can begin with the end in mind, then you can avoid what is, I think, one of the greatest problems the United States has today, which is we keep majoring in the minors. You know, I'm not a kid anymore. And I spent most of my life being the youngest person doing whatever else I was doing. But when you realize that, I mean, I've reached the age when I would rather work than play golf. First of all, I'm not very good at it anymore. but I would rather work because I don't know how much time I've got, and I'd rather spend it on somebody else. But we are paying this incredible price by spending all of our time finding ways to be effective and looking down on other people. And it's eating us alive when if we could just get up every morning and tip the scales inside, and that's all we can control, you know, the scales inside us, it would make a whole different world. And it would do it in a hurry. And someone would have been on every street corner in every city of any size in America screaming about how derelict we were, that we didn't have adequate amounts of the bridge technology. All you do is just hook it up to your skull and it vibrates. 15 minutes later, you're a different person. Why don't we have these other things? So I ask you all to think about that. We're all just passing through here. And we need to step on it.
We could sit here all day and listen to stories like that. They're very powerful, and I think, you know, they're illustrative of kind of what's happening in this space as well, around negative public attitudes for people who are addicted. And there's, as we know, a lot of stigma. And Joe talked about it earlier about that only 10% of the people who need help actually get help. The reason for that is that the other people either don't think they need it or can't, they're too ashamed, right, to reach out and to get it because they think that they're going to be judged in some way. They think they're going to lose their job, or they're going to lose their family, or they're going to lose their friends. They're going to be cast away by society. How do we change that? I mean, you talked about the woman and how she showed up and how people appreciated her. I mean, we have people in recovery like myself have told our stories, and we've risen in our careers to positions of power and to be able to really to change public policy in important ways. But it doesn't seem like we've figured out the way to change those negative attitudes.
Well, first of all, I think a lot of how life turns out for all of us depends how we keep score. Not what we say we believe, but how do we actually keep score? And whether we're all aware of it or not, we're all keeping score all the time on ourselves. And I think one problem is I've heard this, if I've heard all these, this is what you said, I've heard it 1,000 times. Yeah. But there are very few people involved in organizations where they set up a system which methodically keeps score. If the biggest problem is we've got plenty of help, but only 10% of the people who need it are accessing it, then you analyze what you think the problem is. You figure out how you could, in theory, fill the holes. You put somebody in charge, keeping all the groups together, and then you just start keeping score. And you're either filling the hole every month or you're not. And at least 4 times a year, you'll say, we're ahead of our goal or we're a little behind, and why are we a little behind? And you go, this is not rocket science. It's not like we're Da Vinci creating the Mona Lisa. But sometimes it is harder to get diverse people together to have the discipline to keep working on an urgent common goal than almost anything else in a free society. It's harder than it sounds. I spent a lifetime doing it and failing to do it, both. And I remember when I was a young governor, and our state was very poor. And we got all these federal education programs. And they didn't make any sense to me. I mean, they were good, but a lot of our schools were very small. And I said, you know, what if instead of separating out these so-called slow learning kids, we kept them in regular classrooms till the 3rd grade at least with, and I didn't just pick this up, I read this somewhere, somebody was arguing this. And we kept them in regular classrooms, but we made the classrooms smaller, gave them lots of extra help. I said, why don't we try that? So it was unbelievable. In a very rural, poor district, the average score of kids that were normally in that grade with the new way was 50% higher. If somebody had been declared eligible for special education, it was twice as good. If somebody had held back and was serving another year in the same grade, it was 3 times as good. And it sounded simple. So I then sent a notice to all the school districts in the state saying, look, here's what this district did. And the Department of Education will pay you your expenses to send people to this district to study how this is done. And I did it on another thing too, where we reduced to 0 in a rural area the school dropout problem by having smaller classes in which all the people had to learn to write an essay that was autobiographical every day. And all of a sudden, high dropout rates went to 0. Sounds funny. And I sent them a note, so we'll pay for that too. It was shocking how few people did it. So that you're talking about this 1 in 10 thing, and you need a system that figures out why are people not doing something that is smart and continuing to do things that you think are dumb that don't apparently superficially have anything to do with addiction, with dependency. And then you need to map out something you think would work better and then keep working on it. If it works better, keep doing more of it. But most people do things in an unexamined way. That is, they keep trying to push the rock up the hill. Their hearts are good. They want to be right. But the truth is, there's almost always a way to do better. But you got to stop and think and organize so that you will do different things. And I always thought that was my job when I was in public life. My job in my foundation when, people were, I remember when there was nobody giving AIDS medicine in poor countries because nobody could afford it. And so we started talking to people. I said, this is before the Global Fund, on AIDS, TB, and malaria, before President Bush's PEPFAR program and all that. I said, look at what's happening. These people are fighting the AIDS epidemic as if they were running a small town jewelry store. They said, what are you talking about? I said, these drugs are really expensive. It's like a jewelry store in a small town. You got to have a high profit margin because your volume's going to be low, and you have to carry a lot of inventory you may not sell. And I said, what we need is a big grocery store model. We need a massive volume, low profit margin, but certain payment system. And if we do, it will change everything. And pretty soon we'd cut the price of these drugs by 75, 80%. And it got more. But somebody always needs to be thinking when you're stuck in a rut, how do we get out of the rut? Otherwise, sooner or later, you abandon the mission, which you don't want to do. If you think your mission is noble and needed, you're still going to get stuck in a rut every now and then. And Joe keeps talking about it. It is appalling that only 1 in 10 people with specific vulnerabilities and dependencies get the treatment they need. So figure it out. You just need it figured out 1 or 2 places, and then it can be replicated. But I always thought the most exciting thing in public service could be answering the how questions. And almost all of you got a great heart. Your heart's in the right place. You want to do the right thing. And you may think, well, I didn't get a management degree from MIT. How can I solve this? A lot of times it's simple stuff. And keep tipping the scales in the right direction. Every day, you got to tip your own scales. And if you don't do it, nobody else will. Not every day, anyway.
Some closing thoughts, Joe?
Yeah, if I just may, I don't get the stigma. If anything, and I don't want to get people to do this, it should be a positive stigma because the nicest people go to opioids. And people that take opioids medically, 1 out of 5 get addicted to it. I spent 3 weeks in a neuro ICU recovering from subarachnoid hemorrhage because I knew 1 out of 5 people get addicted to it. I refused the opioids. And the pain got so bad. Really, the only thing I could imagine is would someone just chop my head off. Really, it was that bad. And at some point I said, fine, give me everything you got. And it wouldn't work on me anymore. I was past that point. Fortunately, one of the doctors did this block on me where they shoved something up my nose, up to the brain, and injected the opioids into my brain. And when the pain, that helped. And from then on, opioids were working. But I got resistant to it. Like in a matter of a few days, I wanted the full dose, and I went every 6 hours. I wanted every 5, every 4. And literally, Dr. Wilson brought Bridge to me, put it on me, and immediately I calmed down. I became mean. I was really terrible. My wife tells me I felt bad. It's on my way. I hope that's on my way. I mean, when I'm out of it. But in a matter of a couple of days, I wasn't taking opioids anymore. I went from the full dose every 6 hours again to two-thirds, one-third, zero. And I went home without an opioid addiction. So I really believe, I use the diabetes example, with tools, maybe the stigma will go away. So we have new tools. We don't only have Narcan, we have now opioid halo, we have Bridge, and we need to let everyone know it's okay. You got a leg injury, a back injury at work, you got on opioids, you get addicted. Let's help them get over their addiction. There is no stigma.
Thank you so, so much. This has been a fascinating conversation. Thank you both for your commitment, a lifetime of commitment to this work. We really appreciate it. Thank you so much. Thank you, guys.